And speaking of smelling, that's what we're talking about today. The thought of plastic surgery, it can be a little intimidating when it comes to talking about your face. Thanks to this guy, you don't have to worry about that. Welcome, Dr. Stephen Goldman from Beachwood Plastic Surgery. It's really good to have you here.
Nice to be back, Natalie.
So we're talking about our noses because we're talking about rhinoplasty.
Yeah, the smell, transition.
It is, right? But there are several reasons why people have rhinoplasty.
The two main reasons,
surgery.
Breathing, which overlaps with smell, and appearance, right? So cosmetics. So we talk about form and function, and when you perform a rhinoplasty, many patients actually want to breathe better as well as look better. So you factor that in when you're in essence designing the rhinoplasty for that individual.
And I think when someone thinks about getting this, because again, they could have conditions like a deviated septum or something that causes those problems. But I think what I have learned just from hearing people talk about it so much is that you have to go to the right type of doctor because this is the most recognizable feature of your face.
So
and when it changes.
Yeah, so it's interesting. If you know somebody's had a rhinoplasty by looking at them, then that's not a great rhinoplasty, right? So you want it to look natural. You want it to balance with their facial features. You don't want changes that are overdone, but you don't want to have the same nose after surgery as you did before surgery if somebody wants an aesthetic change.
So we have some pictures here of before and afters of people. Now this young lady, what was her, does she want it for more cosmetic reasons or?
So it was for both, right? So a lot of people will basically have some breathing issues that then bring them to the office, but they want to fix some appearance. So this is a nice picture because one, it shows somebody who's just 2 months out. So there's still.
That's only 2 months out.
So that's why we included this picture. She's in that post-operative photograph on the right, she's 2 months out. So if you look on the left, her tip has sort of a cleft in the middle. It's wide, it's asymmetric. Those little light reflections are kind of at different levels. The nostrils are at different levels. If you look on the right side, you're not going to be able to tell she's had a rhinoplasty. One, because there's not excess swelling, but two, because that nose fits her face. But if you look from the side, you see the bridge. There's a bump on the bridge that's lowered. The tip is brought in.
I've seen them when they're too flat on the top then. It looks too flat.
You don't want to look like a ski slope.
Yes.
All right, you don't want to look scooped out, but you also don't want to look too wide. So sometimes surgeons will take a hump down, but not narrow the bridge. So you have to do both. So what happens is cheekbones are more noticeable. Lips, eyes, eyebrows, all the things in our face which are part of facial expression become more noticeable, and the nose just kind of blends in. So somebody can have a rhinoplasty and their friends, even with significant changes, won't know. So,
wow.
So this is somebody who's a year out, right?
Okay.
So you can see this looks natural for her face, all right? Her tip is up, her tip is in, the hump is down, it's straight or just a little bit hint of being scooped out, not too much. And the thing in the middle between the nostrils called the columella, that's often left too low, and that clues people into people having rhinoplasty.
Yes.
So that's picked up. And her whole nose is shorter, and it's just more feminine. So now you see cheekbones, you see lips, you see eyes, you see everything that's part of facial expression. And her tip is even still a little bit swollen at a year. So that'll come down because that skin is contracting. But you can see it's balanced, it's symmetrical, and her face looks prettier.
So when people come to you, they might not, if someone is very ethnic looking, or they might not want to lose certain features because that makes them who they are.
So rhinoplasty is similar to most plastic surgeries, cosmetic surgeries. You don't want a cookie cutter procedure. You don't want to do the same thing in everybody, right? But it's especially true in rhinoplasty. You want to preserve ethnic features, individual features, and some patients may say, this is a characteristic of my family's nose. Can you kind of preserve it?
I think what I noticed from those pictures is they look very natural. They don't look too perfect. They look natural, and that's what makes it a good
So you want
job.
them to be kind of dramatic, but still natural. You want them to be as close to perfect as possible, but not surgical looking, not weird looking.
Love having him on the show. We're going to do a Facebook Live after the fact. He's going to go on my Facebook page. We're going to talk about ways to look younger without having plastic surgery, without going under the knife. He's a wealth of knowledge, so right after we're going to go, if you want, go to my Facebook page and like 11:05, and you can ask him all the questions you want to about this or anything else. Thank you so much for being here, Dr.
Sounds good,
Stevens.
Always.
And again, if you want to see him, he's on the east side of town,
Yeah,
right?
drgoldman.com, Beachwood, Westlake. 2 offices.
Oh, forgot you have the west side too. Okay, thanks so much again.
My pleasure.
All right, coming up here on New Day Cleveland, never replace your basement carpeting again. Love the sound of that, right? How to transform nearly every room in your house when we come back.
Sponsors of New Day Cleveland include